And continuing coverage in news on the potential nurses' strike in Vermont's largest hospital, the union has moved one step closer to taking action. Nurses will walk off the job next Friday if salary negotiations fall through. ABC 22's Malachi Flynn heard from nurses and the hospital, where the administration is preparing for a possible strike.
Vermont Federation of Nurses and Health Professionals announced Tuesday that UVM Medical Center nurses will go on strike for 5 days starting July 12th. The nurses' current contract is up on July 9th, and while a strike date is set, it's not a done deal. Nurses still have 2 more bargaining sessions before then to try and come to an agreement with the hospital. Deb Snell is union president. She says nurses want wages comparable to other area hospitals, a lack of which has resulted in retention problems.
They're going to say that they can't afford this. They can't afford not to. We are losing staff at an alarming rate. We have travelers that are looking at our contract right now, deciding whether or not to sign on as staff. They're giving bonuses for 1 year commitment. That's it. And then these nurses are leaving.
Snell says she understands why nurses won't stay at the hospital, citing the area's high cost of living and lack of affordable housing, and says it's up to the medical center to provide an incentive for nurses to stay. They want a 25 to 29% pay raise throughout their contract. The hospital countered with a roughly 20% pay raise over 3 years.
They are so misguided and frankly arrogant in their belief that, oh, we're a level 1 trauma center. People are going to come, people are going to stay. Well, they're not. It's the same message we gave them back in 2018. This is to retain and recruit nurses. You failed last time. Are you really going to fail your nurses again this time?
Dr. Stephen Leffler is the hospital's president and chief operating officer. He hopes to come to an agreement and avoid a strike, but is preparing for one.
That will be difficult for our patients. It'll be difficult for our staff.
Dr. Leffler says UVM Medical Center will continue to provide care for its patients, and traveling nurses will work through the strike.
We're heavily working right now to prepare to make sure that every person who needs us will get safe, high-quality care during those 5 days.
Leffler says preparations, including bringing in other nurses and preparing for delays in care, could cost the hospital upwards of $10 million. The hospital wrote in a statement that the nurses' proposed increases would cost $100 million and the hospital's counteroffer would only cost $70 million. But it would come within cents of Dartmouth-Hitchcock Medical Center's $39.50 an hour starting salary, which the nurses are using as a negotiating threshold. UVM Medical Center estimates that roughly 500 nurses will need to be hired to offset the strike in order to maintain its current level of service. Reporting in Burlington, Malachi Flynn, ABC 22 News.